Your mic is on.
Okay, everyone, we'll go ahead and get started. We'd like to welcome Dr. Shelley Hearne to the Colorado School of Public Health. Thank you for being
Woohoo,
here.
go Buffaloes, right? Is it?
So that's a lot of enthusiasm. That's good. Dr. Hearne brings an extensive track record of leadership, policy impact, and teaching in health advocacy at the Johns Hopkins Bloomberg School of Public Health. She is the Dean's Summer and Clegg Distinguished Professor of Practice and Director, Lerner Center for Public Health Advocacy. Previously, Dr. Hearne was the president of City Health, which catalyzes city policies for healthier living, founder of the Trust for America's Health, a national organization dedicated to preventing epidemics, protecting health, and managing director of the Pew Charitable Trust Health Group, which included its biomedical research, food, pharmaceutical, and financial security programs. She's also led the Big Cities Health Coalition, which represents the 30 largest cities' health officials. She has experience running advocacy campaigns that successfully helped pass and, and implement important public health policies, such as the Model New Jersey Pollution Prevention Act, Nationwide Environmental Public Health Tracking Network, and many more. She's served in numerous national leadership positions, including the chair of APHA's executive board and vice president of the Council on Education for Public Health. And she currently serves on the CDC Board of Scientific
As of today.
As of today. Okay, I'm checking. You have to.
I haven't gotten a notice yet.
Yeah, you kind of know that real time. All right, so Shelley's received numerous awards for advocacy efforts, including Senator Lautenberg's Award for Lifetime Achievement in Public Health, the APHA's Director Citation, and the
Stuff.
stuff. And, you know, whenever you give your biostat to someone, you're thinking, are they going to read?
Oh,
the whole
yeah, it's
thing for
like,
real?
yeah, no one needs to.
Okay. So we'll leave it at that and just very much welcome Shelley for being here. We're looking forward to your talk.
Thank you, Kathy. All right, this is a cool room. Can we just, you're probably used to it, but I haven't done a round room before. And I think I said to John, who, believe it or not, we used to play basketball together. I'm a little worried. Yeah, you never know what you'll learn in this room. I'm a little worried I might get circular. If any of my logic seems around and around, you know why. But probably to prove that point, I'm going to start off. I wanted to call this Facts Matter. You're supposed to laugh. How many of you think facts matter right now? Thank you, all of us. All right. We have hope. We have dreams. We have belief. It does matter. But particularly now, and it's always been true, but particularly now, you have to know how to use those facts. You have to know who are your target audiences. You have to know where. And you got to be thinking about who the audience is. Actually, I know we've got a marketing guy in the room. Hello. And in a certain way, we've always had to sell public health, right? Because no one knows, so many people are kind of like, what is it? It's a complicated issue. Well, trying to engage in the policymaking process is also a little bit of marketing, in addition to how do we take our evidence, our facts, our knowledge, our experience, and how do we translate it to the audiences, in particular, the people who are making decisions about public health, our budgets, how much money is in there for grants, for personnel, for laws, for implementation, for enforcement. That's all being made by the policymakers, and we need to have public health facts, information getting to those folks so that when they are making decisions about the work we do, they're truly understanding and informed. And we've got to be at that table. But in order to get to the table, we've got to engage with those people. And we have to know what their language is, where they're coming from, what's driving their issues. Come on in, there's room. We got to think about these things. And I actually didn't bring a prop, but I've got a great book for you that's going to help on translating some of these issues. And you don't even have to buy the book. I think this is being given away for free. I heard this rumor. Yeah. We recognized that, well, let me give you a few facts just to help make my case. There have been surveys done. I'm actually not sure if I've got any folks who are working in governmental public health or who have. Do I have anyone in here? Or okay, 1, 2, thank you. And thank you for your service. And I mean it, seriously. So there's a survey that's done routinely, the Public Health Wins. A lot of you may have be using that data. I know in some of the systems work, et cetera. But it's routinely, I think they're up to like 20, 30, 40,000 people that are getting surveyed at the state, local, and federal level, public health workers on what are the key issues, challenges that they're facing. Really a workforce development tool to find out how is public health workforce doing. And one of the issues that comes up routinely is that they need policy engagement skills, but very, very few, the vast majority do not know how to engage with policymakers. So it's a number one, it's in fact one of the top 5 issues that the public health workforce has, but they don't, it's one of the skills they least have. The Public Health Law Network, or the other way around, Network for Public Health Law, recently did a report recognizing that public health is under attack. It's not like this just happened a month ago. We've been challenged for years during the pandemic when we were needed most. Laws have been coming, budgets have been cut, taking away the powers and authorities of a lot of public health agencies. And what the network found in its report is that public health officials, professionals, are skittish from engaging with policymakers. I would use a stronger word, but that was lawyers being nice. They do be diplomatic. There's been research done recently by folks affiliated with the Lerner Center for Public Health Advocacy that's taken a look at all of the syllabi from accredited schools and programs of public health who are required to assure that MPH graduates have the ability to advocate for political, social, and economic policies and programs that will improve health to diverse populations. It's a requirement of accreditation by CEF. But what the analysis has shown is that the vast majority of our schools and programs do not provide that kind of comprehensive training. And it's part, you know it in this room, there's the challenges of how do we cover all of this curriculum. There are a lot of competencies that are being required. We aren't often in academic circles encouraged or have faculty who are experienced in policy engagement. And sometimes there are fears that if you do engage, there'll be ramifications. And that's certainly, we'll be honest in this room. Well, I'd like to be honest everywhere, but certainly here as we're talking about these issues, it's part of the turmoil right now. It's part of our challenge. And I really want to dig into this, and please feel free. I'm going to run through a lot of issues and a little kind of inside tips and some strategies to think about and how to deal and get you, I don't care if you're a student, faculty, or staff, or in the public health workforce, we've got to be the ones who are engaging with the policymakers. We never could afford to be timid or skittish, but particularly now, we really can't. And our years of, no, we just research and analyze and don't engage are part of why we don't have political will and support for the work we do, because folks don't get it. And this is not saying as blame. We just have always thought we're doing extraordinary work to make people healthier, thriving, better health. If you just tell people the facts, that should be enough. That's how we all were trained. But facts don't speak for themselves. Facts have to get translated and inserted and trusted in the policymaking world. And we're really trustworthy people. But they don't know us. They don't know us. And these relationships take time. And they can be really helpful for us, regardless in the good times or the bad times for health. And I'm going to dig into this a little bit more. The Council on Linkages between the Academy and public health practice has put together the competencies for what all of our public health professions need. And built into every single one of the domains of competency are actual advocacy components. So regardless of who you are in the public health field, an epidemiologist, a data analyst, work in the laboratories, doing community engagement partnerships, working on health equity, communications, all of them have core components of advocacy skills required within them. And the key domain on leadership and systems thinking, there is a specific criteria, competency, that you must be able to advocate for public health. Regardless of who you are, those advocacy skills are core, that we all need to have them. It's not okay, the person who is in the research lab may be the head of NIH in the future. And that's happened over and over. And that head of NIH has got to be effective in championing our issues, in translating our facts and findings, and having deep relationships with Republicans, Democrats, independents. They have to cross worlds, business, religion, community groups. Advocacy takes a village, and you got to have relationships in all those places early and often and continuous. And that's baked into our competencies, but we still are skittish, and we're going to talk about that. ASTO, the Association of State and Territorial Health Officials, ASTO, well, how do we come up with these acronyms? I do not know. We need to work on this marketing. NATO, everyone thinks it's like tacos, and ASTO is, we won't say what they think. The de Beaumont Foundation and APHA have produced a series of books for practical skills for our field. And it was all started with those WINS survey of what do people want to know, but don't know. And here's some primers, some really basic 101 on how to do those things. So this book, Policy Engagement, a really sexy title. If I were being able to choose titles, I would have called this book How to Make Shit Happen. And I'm from the environmental field, so I'm allowed to talk about shit in a technical, professional way, right? I was actually, the irony is I was trained as a toxicologist, but that's, I have become focused on how do we make policy happen, because it's what our field desperately needs. This book, which I co-authored with Keisha Pollock Porter, and I think a number of you have worked with her. She's, a million years ago, she was my student, and I said to her, someday I'm going to work for you. And I've only said that twice in my life to people. She was one of them, and now I do work for her. She's the chair of our Department of Health Policy and Management. It was wonderful writing with her, and then Katrina Forrest, who now heads up City Health. And we were brought in a series of skills on people who've been in, worked for legislators, people who've fought against legislators, and others who have studied legislators. It was the three of us. And we've got 5 basic themes that came out of this book. And all of you get to have your own copy. It's your bonus prize, or I don't know if you, well, I won't start going, yeah. You don't even have to read the book now, because I'm going to tell you its basic insider scoop of what it says. But it's written in a way I hope is entertaining. Though John told me, the good John Salmon told me he just read it on his flight back from Nairobi, was it? So John Salmon, he was, and he said, yeah, it was great. It's a great primer, but it's so 2024. I'm like, man, John, he's right. It's written for, this is how policymaking works. And the rules are a little upside down at the federal level right now. But that's okay, because how we're going to deal with the upside down times, there's still some really fundamental rules of what we can do and should do and need to think about. There's short game and there's long game. And the reality has also always been, you've got to make policy happen at a local level. It's where we have the ability to have facts matter the most. I think there's sometimes an inverse relationship of where facts matter and where they don't. And they matter most at the local level. And we have the most control at the local level, right here in this room. And federal policy gets built by the experiences of good policy working at the local state level. And if you get enough states doing that policy, others follow. We've seen this over and over again. Certainly, you pick the issue, and if you get a few leader states, take a look at what California was always 20 years ahead on tobacco policy. I mean, you name it. And eventually, everyone caught up. And if the feds don't put it into place, you have enough states, the companies, the industries start following those rules anyhow, because they can't afford to have a patchwork system. It's like Prop 65, the environmental law that was doing labeling, just information on products that were hazardous years ago. Now, no other state picked up that law, but no industry wanted to have a label if he made it, with California being the 5th largest economy in the world. You weren't going to make special products just for California. You might as well make it universal. And they didn't want to put a label saying this is cancer causing. And all of a sudden, the ingredients that were in these products disappeared overnight, 6 months to a year, just because of a law that passed in one state. Local matters, always has. So we're going to talk about how do you engage effectively, not standing on the mountaintop and preaching, which is what we love to do in public health. But how do we sell our product, public health, good, effective policies that are evidence-based? We've seen them work with our experience. We know the data. How do we sell that to the people who pass the laws, pass the budgets, make these decisions? How do we sell it? So I'm going to start with 5 overarching kind of themes, and then I've got 10 tips that fall into these buckets. on how to make shit happen. We keep the title in just in this room. Okay. The APHA press probably doesn't like that, but so number one overarching theme, and I know you all know this, but it's really important to emphasize, is that policy is messy. Doesn't happen overnight. You have the greatest idea, the best evidence support it. You even have some champions in that legislature. Doesn't happen overnight. Takes a lot of work, a lot of conversation, a lot of people engaged in it, a lot of back and forth, a lot of iterations. The perfect bill never is what passes. It may take years. A lot of people get their hands in it. It's not just the facts say this, so therefore it's this. It has a lot of different layers in it, and you have to be understanding and patient. Doesn't mean you accept really bad bills. It just means you have to recognize it takes time. And sometimes the most important thing in policy, when I say policy, I'm not just talking about passing laws. What are some other policies? Help me here. What's a policy? Come on, I know there are policy people in the room. Yeah, so you can have policy, it's not a law, but it's a university requirement. So no legislature passed it, but you got the university to do it. So yeah, your decision makers could be the university. Okay, you're gonna get me in trouble right from the beginning. That could be your targeted audience. Who else? Where else is policy being made? Executive orders, so your governor, or, well, you're your president, or in a county. I am upset about what's happening to the evisceration of our budgets and our funding and our programs in public health. But have to recognize change happens with all these administrations. This one's dramatic. But I have seen under Democratic transitions, some things that are near and dear to public health get eviscerated. I've seen Republican presidents end up becoming the public health champion. Don't forget, some of you may not have been around for George Bush, not Jr., but whatever is George W. Bush. Ended up being one of the biggest public health champions. We got off of rotary phones in our health departments because of the extraordinary investment that took place then. Change can happen here. We don't know what's going to, we're at a point now of it's bad and it could get worse. We could see the NIH overheads cut. We could see further things coming down the pike. But with engagement, not just from the courts, engagement can change things. And we don't know what 6 months are going to be. We don't know what 1 year is going to be. And we don't know 3.5 years. Engagement matters at the federal level now, too. This is not us standing back and going, woe is me, as the tsunami hits. Every member of Congress is counting the emails and the phone calls they're getting. They can't avoid town halls forever. And the more that this is a bipartisan, people from industry, religious groups, community groups are standing up and saying, you can't cut vaccine hesitancy programs. You can't cut the programs that were helping out on affordable housing, on low income, on heating programs. I mean, it's a long list. It matters. It's messy. It's really messy right now, but that doesn't mean being paralyzed. It's understanding this is a point in time and we are part of how to help get facts back into the equation. How you engage is personal. It's the second bucket of theme here. I am not advocating that all of you have to go and stand with signs in front of your members of Congress or demonstrate in the street. What I am saying, there's a very long spectrum here of how you can engage. And I'm predominantly focused, and as this book, on where you as a public health professional, as a public health champion, as a leader, as a teacher, can take your knowledge and engage at the local, state, at the federal agencies, assuming they're there, at all levels, all places, how you can engage and make a difference. Because over and over, I have seen it and I continue to see it now. Advocacy or aligning your message with your target audience, it may be the most critical point I could make today. I was being a little flip when I said we can't stand on the mountaintop, but you know what I'm saying when I say that. We're in this field of public health because we care so much, right? You're not here to make your millions. I mean, I would love it if you are. But you're here because you care about something. You care about people. You have a passion for equity. You hate when you see unfair situations. You're fighters. I say that in a loving way. You're champions for often the underdog. That's kind of what I think of in public health. It always has been. But sometimes we get, it's that circular thing. We talk to ourselves. We have our own language. I mean, now, thanks to the pandemic, people know what epidemiology is, okay? So that's okay. It used to be a skin disease, but now they know what it is. But we have this whole language that no one else knows what it is. And sometimes we get so caught up in that, and I've been one of them. Again, you know us toxicology people, we like to throw around our formulas and things. But we got to translate. And sometimes we don't understand who we're translating to. So I have watched really good policy ideas, exceptional policy ideas with all the evidence behind them fail because the deciders, and there are a few in the room, please don't hear this wrong, but they were all over 60 white men in a legislature who are going to make the decision on a law. And if you go in with language that they either don't know what it means or frightens them, you have to go, you have to stop in that moment of, am I here to frighten them and get them to think differently, which can be a long-term goal, or am I here because I know there are kids dying right now, they don't have enough heat, or they're being told that vaccines aren't safe, or they're in jail and they're not getting proper access to treatment? Am I here to get this law passed, this policy passed? Or am I here to educate a bunch of old white guys who aren't going to be here for very long, but probably another 5 to 10 years? And it's a question to you of when you go in there, what are you trying to do? And for me personally, language change doesn't come there at that moment. It comes in other places, and we can work on it in other ways. But not when you're trying to sell the deciders on who gets what money or what law should get passed. We've got to know who they are and how to translate our data, our facts, in a way that they can hear it and go, yeah, great idea. Return on investment. Yes, I'm for that. And it's not antithetical to us. It's just simply recognizing how to present the information in a way that they can hear it and act upon it. Advocacy or policy engagement is not lobbying, and lobbying isn't a dirty word. Now, almost everything you do in this room when you engage with policymakers would fall into an education category, and that's all allowed. That's not advocating, even though you're championing something. But it is important to know the laws and the rules. I don't know Denver, Aurora's rules, and I don't know Colorado's. But I can guarantee you, you speaking with a policy maker about what you know is not advocacy. Sorry, it's not lobbying. Don't get scared off by that. And then the last theme here is that policymaking takes a village. And one, thank you all for being in here. And two, we're just a start of the village. We're like one hut. We have got to pull in a lot more people to be championing our issues. Yes, it's communities, but we have also got to, and this took me a really long time to learn, in part because I come from the environmental field and I always was taught industry bad. They're trying to kill babies. I'm just, you know, this is when you're in the environmental advocacy community, you kind of get in these boxes. And what I found is the greatest successes of passing the most hairy, audacious laws required thinking outside the box and finding allies that you would never expected. But if you think of industry as a monolith, then you'll never find them. But if you recognize there are a lot of different interests and needs in industry groups, you can pluck out people to come in and champion with you. And that turns heads. That gets people to listen. And that's what we need, is people to be working with us, not just public health hut. We need a bigger village. Do we need to do exercises or something? Is everyone okay? It's a little hot in here. I'm doing a lot of chatting. Please jump in if you don't agree, or what the hell do you mean by that? Or right on, sister. Thank you. I got a right on sister up there. Woo-hoo! Woo-hoo! Okay. All right, so here are the 10 tips. Don't have to read the book. Come get it. I'd love to talk to you. Who are you? We'll go from there. But here's your cheat sheet. So number one, this is going to sound weird, but it's actually really key. So what's the public health goal that you're trying to fix, to solve? What do I mean by that? And it sounds basic, but what? Come on. What do you think I'm trying to say here? I don't know. Well, kind of why are you in public health? Give me something. All right, oh, I love that. I love that. All right. We tend to get into, again, this is the public health speak. Like, I'll ask you, hey, what are you doing? And we all, because we're passionate about this, we go into this dissertation and about SB 1954 and the, you know, if we fix Title VI on this and we get this, you know, and people are like, what? Okay, sure. Versus what's the health problem that you're trying to deal with? We got kids who aren't healthy, who could be. We got Black women dying at 3 times the rate of white women in childbirth. Every one of you has something that makes you go, this is not okay. It gives you fire in the belly. It's really important to anchor on remembering why you're doing this. Because when we go off and we're championing something or making a case for a policy, we tend to get weedy. We tend to get in these like micro details. And people are in the, well, why do I care about your policy? Well, because of this health problem. I had a lovely fast lunch with the dean today, who did a, I'm gonna out you on this one. Talking to a legislator and saying, we will have a measles outbreak here. What do you mean? And vaccine hesitancy funding matters. And bada bing, bada boom, not to say it's a good thing, but you already have had a case. 2 now? Okay, and it's gonna, and you're gonna be able to talk about these issues. But it's in the, kids are dying in Texas. This isn't theoretical. And being able to connect to the human face and what it's actually about is so important. Why you're here, and it's actually what's going to resonate the most with the people that you're working with. And Angelica, this is why I was pushing you in the, you are working on a really good issue on affordable housing here in, not here, Adams County, but here in Colorado. And we have to talk about, and we all do this, if it's housing or substance abuse or tobacco, well, what's that doing to health? What's that doing to people? How does that relate? That's why you're doing great work. So tip 2 is engage with these policymakers and be a resource. I'm going to out you now, Lee. Your NIOSH just got eviscerated. But you may not. But you already have, why? Because you guys have long been engaging with the people who make these decisions on the budget on NIOSH funding. And I trying to kill us for 15 years. Yeah, and you're still alive. And why? Because this happens all the time. This isn't just now. And you've teamed up, you have a village of other universities, and you've actually hired a lobbyist who's got long-term relationships, and you have long-term relationships because you've been fighting for 15 years. And so here it goes again. But it's not, you're just popping up for the first time ever going, hi, I want you to fund public health. These people know you, and you've translated it before, and that matters. We have got to build those relationships in good times and in bad times. This isn't the start of a song. We could have a little, okay. We've got to know these people, and they got to know us. And again, it gets back to, you have got to be at the table. And I've seen this out, again, students, staff, faculty. Those relationships, maybe your neighbor is on the school board. Maybe you have kids that happen to go to the school with the mayor, town council. Those really matter. And it's the, hey, what do you do? Don't go wonky, translate for where they are. I'm here to keep kids healthy from ages, I mean, all kids, but they'll ask you another question if you phrase it that way. And then they'll start to dig in more and more because you're relating, and they're going to relate to things that they know and care about and understand. Relationships matter. Go out and engage. And working at the local and state level, I'm the broken record here. You're going to hear it a few more times. You can do it now. It's not Crazyville. There are really big decisions being made about health, school level, county, town, university. Get in there. Be strategic. And I was alluding this before. There are no permanent enemies or allies. We've had Democrats kill public health programs. I know I'm repeating myself, but it's happened. Don't assume Democratic Party is the public health party. And do not assume that the Republican Party is anti-public health. We have got to be able to work across the aisle at all levels, and particularly for sustainability of our policies. You've got to have that commitment on both sides, because otherwise one party comes in and bye-bye, we didn't like that, that was another group. But if you got support on both sides, that's the long term. It's absolutely critical. And this is true in industry. Again, I said this, do not assume that industry, everybody is opposed to you. There are ways to analyze and understand who in industry groups could come out and support your issues. How am I doing on time? I don't have a watch. Okay. So I said this before, but all forms of engagement are okay. You've got to know what works for you and what fits in your professional and personal being. Not everyone has to go and testify. Some people don't like that. You don't have to go write an op-ed. You can. You can work with an organization and be their technical person and help translate information for them. Work with an agency to be a resource for them. We've got all kinds of, I know you do here at Colorado, and it's routine at Hopkins for our faculty to be sitting with staff on both sides of the aisle in Washington and in the agencies to help translate. We had the teams in with the drug pricing. They were looking at the different economic models of if you picked this drug and did this pricing, what would be the implications and ramifications to the industry? What would be fair to them? And for pricing out for individuals. Being a resource and helping just think out regulatory strategies. Or even agencies don't have enough people who even understand what the current science is. There are a lot of people in this room that play that role. It's not a public and a visible role, that's a service role, but absolutely critical. Even joining your associations, your professional associations, and engaging with them to be a resource on picking and choosing different issues, or helping them again in writing letters, comments to agencies, comments at the local, state, federal level. Those federal agencies, as much as they're in a challenged time right now, are still going to be going through implementation of rules and regs. They're still having to take in data. They're still going to be the Federal Register notices coming out asking for certain information. That is a great place for all of you to be able to engage and provide information to answer the questions that they have, because they're especially going to be under-resourced now. They need people to help put that data into play. So engagement can be in all different kinds of shapes and forces. It doesn't, you can be highly public, highly engaged, or behind the scenes doing just as important work. That's creating those relationships and that trust and that knowledge. So don't do anything that doesn't make you comfortable. I am here to push you a little outside your comfort zone, but at the end of the day, you got to do what is right for you and where you sit and what works for you. And one of the most critical things is in all of these engagements, all of them, regardless of who you're dealing with, is be you. Don't try to think you have to do something else if you're being a public health champion or advocate. You know, again, we don't, the only thing we really have in our field is credibility. We still have it. I don't care some of the pushback that's happened. But people can sniff out authenticity. They can just smell it. And even if you're telling some hard truths, if they can sense on where you're coming from, they're going to trust you. You're looking skeptical on that one. I've seen a few skeptical faces here. They will. Helps having white hair, but seriously, be yourself. And that is just what I'm saying is credibility is what it's all about. And when engaging with those policymakers, if you don't know something, say it. I don't know, but I'll get back to you when I find who does. And I have found that is the biggest boost to your credibility, is when you acknowledge that you don't know something. And I don't know why it's the hardest thing for us to do, because I know I often don't know. And I'm hesitant to say that. But the more you focus on, here's what I do know, and here's what I don't know, but really following up is another way to fortify those relationships. I said this before, lobbying and knowing the rules, if you're actually engaging and going out to policymakers, there are some very fundamental lobbying rules at the federal level, but they do exist at state and some local jurisdictions. At the federal level, they're all defined by the IRS, the Internal Revenue Service. That may not matter anymore. I don't know. But it is important to know those rules if you're in the directly advocating for specific bills, specific legislation with elected officials, and in some places with administrative. But it's predominantly, it's something that is best to know if you're at that level of engagement, but otherwise it is not something that you are generally doing. What's key is you're not alone in this, and nor should you be alone in your policy positions. And in fact, if you're alone in your policy position, you might want to rethink what you're doing. Because if you're the only one advocating it, then there's something off. This gets back to it takes a village, but sometimes in our evidence gathering and facts go, oh, okay, I see all this. So this is what should be done. Well, we need to go and take the temperature with the community groups that are impacted by that, the interest groups that are going to be impacted by your policy idea. And there are a lot of organizations in all of our issues that are often focused on these policy areas. And the great thing to do is to go find, who are they? Do they line up with your values, your North Star? And maybe that's who you work with. You're not out there solo. You have a brain trust to think out things, and it's a place you can plug into versus being out there as the sole champion. Because while your facts might say one thing, the factors on the ground, the political considerations, the fiscal, the administrative issues, the cultural issues, social issues. Do I have any policy? Who are my science policy people in the room? Good. Okay. All right. I was going to start drilling into a little kingdom, but I won't go there. But there's a whole science to the facts say this, but how do you translate it into practical policy? And that's where you need to have others involved in an organization. So particularly from an academic setting, it is best to be teamed up with the key organizations that line up with your issues. And lastly, persistence. This gets back to that point of policy is messy, and persistence matters. You got to stick with these things. It's not you testify, you write an op-ed, I'm done, did my job. These things take years, or as Lee was pointing out, they've been under attack with their budgets for 15 years. So you got to defend your budget every year. Well, that's life. That's what you do. Or when you get a really good law passed, it's the devil's in the detail. It's actually how the rules and regs that get written up that make the biggest difference. And does it get funded? Does the law get funded? And did the government agency hire good people? Did they even hire anyone? And are they enforcing it? Policy has many stages. And you as the experts in understanding and evaluating it and tracking it can be the best resource, but must be persistent ones to make sure it is happening all through its life, the policy. So now you don't have to read the book, but I think it's written in an entertaining way. And I've had a number of people around the country, people who are policy experts who've come in older than me, who said, I've been doing this for my entire career, and I've learned some new angles and new directions that I'm going to try implementing. And a lot of folks who are, I don't really know what this policy thing is. I know it's important, but it scares the daylights out of me. Say, okay, it literally goes through you want to start putting your toe in, just want to go start, think about doing these following things. So as simple as voting, registering to vote, elections matter, and showing up at town halls and asking public health questions and writing to your members of Congress. I have Nancy Mace. I actually live in Charleston, and I have written her several times. I just had to do a talk at the South Carolina Public Health Association. And I said, look, I'm wanting to talk about what's happening in the policy arena, and I would love to hear from someone in your office on what you're doing on the issues that are affecting your public health workforce in South Carolina. It was not in an adversarial way at all. I was simply I want to be able to talk about what your office is doing, because you've got hundreds of people who think they're going to lose their jobs in your district. What should I say? Now, I didn't get a response, but I'm going to write again, and I'm going to keep at it. And we got to talk about these issues. Got to hear that people do care about it. Persistence matters, and your facts matter even more if you stay persistent, translating it and getting into those places. So that's what I had to say. And I also invite any of you at Hopkins. I mean, we have the benefit of we're a private institution. We have advocacy has been written into as the fourth pillar of our school's mission: teaching, research, service, advocacy. And it's the dean made a determination through our, the strategic planning process that while we're the #1 research institution in the world, our facts don't matter if we don't get them into the hands of policymakers. So it is a pillar of the school. And we do have the benefit of you can get promotion and appointment through those activities. But most people this is not part of your R01s or your funding or your salaries. It's part of, this is what public health is. And we're putting together for schools and programs of public health, we're starting in the summer, workshops on how to think about advocacy and incorporate it into your academic work. And this will be, there's a in-person in Washington, D.C., but most of it is online, creating a cohort across many schools of public health, the people who are thinking about how do we start baking this into the work that we do. So I invite folks who may be interested in doing more. And I am thrilled to have spoken with all of you because this is a institution as a public health school that has been a poster child for me of having faculty, staff, and students who are engaged in the policymaking process and encouraged. It's not easy. It's not the often, again, in the balance of having to do a lot of things, but I'll come back to why are you in public health? And how do you keep those kids healthy? Or whatever the fire in the belly is that's brought you here. What you're learning, what you know, what you've experienced through all your years of work, making sure that the people who are making decisions about how our lives are going to be impacted and making sure they are hearing from public health is the difference maker. And so do not let this time paralyze you at all. This is about persistent, long-term relationships, being out there. It's not in an adversarial way. It may be sometimes if that's what you choose to do. I'm not saying one is better than the other, but I am talking about when you are, as a public health professional engaging, you gotta be in the game. And we have to support teaching it, encouraging it, and being it. So thank you. All right. Anyone? Yes, no, that was crazy. What do you have? Any questions? Anything I can do to be helpful? Behind me. Yes. Well, thank you. So what do you do?
We work at the, we work
Good.
at all 64 counties.
Great. You're making it real. Thank you. Thank you. Great. Well, you didn't need me here. There you go. There you go. Yes, sir. Mm-hmm. Well, yeah, I do. I do. I'm going to put on a few hats. A very long time ago, I worked for the Pew Charitable Trust, which is a very large, it used to be a philanthropy. It's now actually a 501c3, an advocacy group, but it still has $4 or $5 billion asset, and it used to be a grant making. And I reviewed hundreds of grants. And it was really surprising how rare it was to see right from the get-go, here's what it's all about. Here's what we're trying to do. Why does it matter? And it was those ones that started off there, that got my attention, and then spelled out how we're going to, the work we're going to do, why it relates to ending childhood obesity. reducing asthma rates, not treating, reducing cases, actual prevention. Again, whatever it is, how do we get the numbers of tobacco down, whatever it is, substance abuse. But talk about it in what it was doing to people's lives, and then get into, here's the logic trail of why what we're going to do matters to that big picture. It's stunning how much, and this is again because we get caught up in our research and our kind of silos, that we disconnect from the human face of what it is we're doing. And it's the, like, I am shocked by how many times you have an event take place and the reporter comes to ask you, okay, what does this mean? And we immediately go into the solution without going, I am really sorry that this tragedy is happening. Because we're so we're going to go off to the fix. And it's, again, it's now the 5th time I'm saying it, but it's why are we doing this? Why does it matter? And I know the torture that I sometimes, and a few of my colleagues do, you probably do it yourselves, you and faculty, and anyone who's in the doctoral program, I'm giving you a clue on the question you're going to get asked in your dissertation defense. It's well, so what that you're doing this? Who cares? So what? You need to be able to answer in human terms, why does your work matter? You need to answer it for a research grant if you want to position yourself well. You need to be able to answer it for the reporter who's asking you on something. You need to answer it for your dissertation defense. Because this is public health. This is not biomedical research. This is not about some bench discovery that's going to maybe have applications in 60 years for some drug discovery. You are working on today's problems. And we make a human face on it, makes other humans be able to relate to what we're doing. So I don't know if that answers your question, John, but it's the so what. And if you can distill that right up front, it's like, this, you may do this in your practice courses. We do this in a lot of, actually, I may do this in the workshop tomorrow. What's your elevator speech? Do all of you have one ready? Do you have 2 sentences when you bump into at the soccer game, the policymaker who says, what are you doing? And you got the 2 sentences, say this is what it is and why it matters? It's not easy, and it takes a lot of thought. Distilling is hard. We can do 5 pages really easily, but we don't do 2 sentences well. Connecting the dots. And that's the kind of way we have to be thinking. The marketing guy will tell you that. Yeah. It's hard in the circular. Yeah. Hi. Okay, that's great. So it's a great question, and there are a few things I could suggest. So one is certainly getting the communication skills, and I don't mean just how to do public speaking. I'm actually talking more about something I would call media advocacy, which is the ability to communicate ideas and concepts and respond to questions that bridges to the policy ask that you have. We have a lot of time people respond to the press and get great quotes, but they actually don't have anything to do with what your fix is that you're recommending. So we often see though, oh, this is a crisis. Okay. Everything in public health is a crisis. Being flip, but it's how do you have the one-liner that actually, so that the quote that you get is contiguous with what you're asking to be done, because it's the ask that you want to be in the quote, not the problem. You want the solution in there. And that's a learned skill. That's not an automatic. No one has it automatic. It takes understanding how to do that and practice. So there can be communication classes doing that. But what you were getting at is, how do I find out? It's like the sheep, the wolf in sheep's clothing. And there are different health notes, there are different tools that are being developed, legislative tools, and I think they're being taught here. I think Greg had mentioned, Tong had mentioned to me some of the, they're different language that they're in different states called, but they're basically health analytics that are done to look at policy to show the return on investment, the impacts on different communities. Is this helpful or harmful to vulnerable communities? So those are very specific tools that I'd very much recommend. But the other is as you dig into advocacy competency into courses, one of the basics is to analyze the pros and cons of an issue. In part, it prepares you to know the weaknesses, and you do what's called opposition research. And you normally hear that term in politics, where you're running against someone and someone does, they call it, the oppo work, where they go and find all the dirt on a politician that you're running against. Well, this is actually doing the opposition research on who might be supporting the bill and who's opposing the bill. And you get really important clues when you follow the money, you follow the organizations that are behind, maybe sponsoring, who's on the legislative body is supporting it, and where are they getting their money to support that bill. It's doing that next level of digging, and that is what journalists do, but it's not exclusive. That's just they know to get beyond the surface of the story and the spin versus what's really driving it. And those are asking those same questions and doing the due diligence on who's for it, who's against it, where's the money coming from, and asking other interest groups that you work with, what do they think about the bill? And that's doing your homework to find out what is really happening in there, because there are a lot of false groups that are set up predominantly by industry, have really nice names. I've seen this immensely in the tobacco world, see it in, it pretty much, you pick the issue. And there are these fake grassroots groups that have been set up to advocate for a certain policy, but in fact, they're not the people. They're not, the angry. It's industry generated and made to look like. And that's where you have to do your research. And that's true in this modern day world with all information. We're in a day and age of harder and harder to find out what's true and what's not. And that's part of our challenges. Right. Yeah. And that's the, but that should be the absolute question and due diligence that we should all do when engaging and finding out what's real and what's not. Yes, Angela. Well, I'm going to end on that. Yes. Yes. Thank you. And great meeting you all. Thank you. Sure. I'm going to